Hello friends, I am Sonika Mishra and presenting Arka Hospital COVID Aware Door. Here we will give you a daily update and we'll have a proper discussion with Dr. Praveen Ramachandra, who is an endocrinologist and playing a key role in Arka Hospital. Welcome, sir. And so today's my first question is like that: how soon might COVID symptoms appear?
See, the COVID symptoms, once the person get exposed, okay, once the person get exposed, after that, what we call as an incubation period. It goes from, for COVID, it ranges from 2 to 14 days. The person is infected, but before he exhibits symptoms, that duration is called as incubation period. It can vary from 2 to 14 days.
Okay, 2 to 14 days.
The newer variant Omicron and all, the incubation period has become very short. Now, some 2 to 3 days only symptoms will start.
What are people with COVID most contagious?
Contagious, when they are contagious, when they are likely to spread the disease. That is between 2 days before the symptoms appear and 2 days after the symptoms goes away. That is the duration inclusive of those two before and after, where at the time the patient is most contagious.
Okay. Right. Okay. So how do we calculate our isolation period?
See, the isolation period where we talk in terms of day 1, day 2, day 3, like that, correct? So the we calculate the date of first symptom. We call it as day 0. Whenever we developed either cough, fever, or body ache, that will be the day 1. Then when the patient has the symptom day 0, the first day, the next day after 24 hours will be day 1 and day 2, day 3, like that. That's how we calculate.
Okay. So first day will be 0 day, right?
Yeah, day 0.
So when should we call a doctor?
See, the doctor, if you're home quarantined, then what you have to do is you have to watch out for your respiratory rate and pulse rate and oxygen level through pulse oximeter. In my other video, I have explained how to use pulse oximeter. And another thing I have told in my other video is 6-minute walk test. So you have to learn how to do the 6-minute walk test. That will indicate how bad is going to be your symptoms.
Okay, so for testing that, you would have a separate video, right?
Yeah, 6-minute walk test will be able to find out are you going to deteriorate further or not. It's an early indication, so that we can pick up the thing much earlier. That's the benefit of 6-minute walk test. And other symptoms like chest tightness, if they develop, or they develop breathing difficulty too much, if they develop their fingers becoming blue or something, these are the certain red flags which a patient should, if they come with their own quarantine on their own care, and then these symptoms comes, they should talk to their doctor.
Okay, great. This is really great knowledge and information. So what if we test positive using at a home test? So what should we do after getting positive?
If you test positive, there are two things actually which happens. If you test positive and you have symptoms, okay. If you test positive, if you don't have any symptoms, you should isolate yourself in a room with a standard isolation protocol so that you don't spread to other family members. In my other video, I have told about what are the safe isolation practices at home. So you isolate yourself in your home, and if you test positive, there is no symptoms. Okay, one set of patients will have test coming positive but no symptoms. They should isolate in their home or the room for next 5 days. After 5 days, if there is no symptom, they can wear mask and go outside. That's fine. Isolation ends at day 5. Similarly, if they have test positive, also symptom. So the one thing is both occurring together, then standard isolation period will be 5 days for them. And especially the fever should have subsided more than 24 hours before ending the isolation period. You know, without taking paracetamol, fever should not be there. Then only you can end the isolation. Another thing is today test come positive. It will take 2 more days to appear fever or cough. So your day 0 will become after 2 days. Okay. From there you have to count your 5 days. Then you have to end your isolation. It's like that.
Okay. I think my next question is related to this. Means when can we be around other people after having COVID? So as you said, means after appearing symptoms, we should take a 5-day, right?
Yeah, after appearing 5 days isolation, if the symptoms have subsided more than 24 hours, with a mask for next 5 days. Once you have ended your isolation, you can go around with other people, but always for next 5 days, compulsorily you have to wear mask also.
Okay. Do we need to test and isolation or quarantine?
Yeah, your question is, do we have to do the test when you want to end the isolation, correct?
Yeah.
So it is not recommended. If you are positive and you have no symptoms, after 5 days you are going to end your isolation, then don't do any requirement of doing RT-PCR or any other test to COVID is not required. And if you have symptoms for say like fever, cough and all after coming positive, in that scenario also, after 5 days or after your isolation, as I told, in symptomatic people has to end. After that, at the end of isolation, no need to do the antigen tests.
Last question is that, okay, what kind of test should we use if we do want to test before leaving isolation?
See, if at all a person or a patient insists on doing the test at the end of isolation, although it is not necessary, if some people want to make sure that they're negative before going out or mingling with their family members or like that. So in those patients, I would recommend going for antigen-based test. There are 2 tests, antigen-based test, antibody-based test. Antibody-based test should not be done. Only antigen-based test has to be done. In that also, I will not recommend RT-PCR. I will recommend rapid antigen test because RT-PCR, the problem is very sensitive test. Even the dead viruses, although they are not actively multiplicating, it will pick up and show it as a positive. So RT-PCR should not be done because so sensitive it is. It will even pick up the dead viruses as a positive test. So go for rapid antigen test. So in the rapid antigen test, if it really has to come positive, the viral load should be very high. So rapid antigen test I would recommend in that scenario. And if the test comes positive, again they have to undergo 5 days isolation. That's what I would like to recommend. And the person whose test comes negative, another 5 days they should go out, but with wearing a mask.
Okay, it's like a precaution.
Yeah, so 5 days isolation, 5 days strict mask. So total 10 days, kind of effective social distancing.
Okay, great. Okay, sir, thank you for your precious time. And friends, if you also have some question regarding COVID-19 or something like that, you can ask in comment box. And please do subscribe and share with your friends so that they can get benefited. Thanks for watching. Have a great day. See you tomorrow.
Thank you, Sonika. Thank you all.
Okay.